give some information regarding brain stroke for the general public. Since the 29th of October, every year we observe as a World Stroke Day. So it is an important day for all the neurologists and those who are specialized in stroke to give some information to the public as far as the brain stroke is concerned. As we are aware, brain stroke is one of the debilitating diseases for mankind all over the world. It affects nearly about 18 million people all over the world, and about 1/3 of them are affected with a severe disability, 1/3 will die, another 1/3 will require support for their day-to-day activities. So that is the severity of this brain disease. And what is brain stroke? To tell you in a simple way, brain stroke is nothing but a blockage or the bleeding in the brain due to multiple reasons. The multiple reasons could be many, which I will enlighten you in the subsequent talk. But it affects both male and female. It can affect the causes for the brain stroke could be anywhere from childhood to the elderly population also. But commonly, when you say brain stroke, it affects somewhere between 40 to 50 years of age onwards. And every decade you pass through 60, 70, 80, like every decade it increases in frequency. And most common type of brain stroke is a blockage or an infarct stroke, which amounts to about 80%. And this is the one thing which we want to concentrate because it amounts to a major bulk of the stroke, and it can be managed in a very effective way nowadays. Earlier, about 20 years back, we had nothing to treat stroke. Now we have many things to treat stroke, and we don't see patients who are affected with the stroke walking with a stick or able to manage themselves with the availability of modern treatment and diagnostic therapeutic agents. Now, in majority of the stroke all over the world, it occurs, about 80% occurs in the third world countries which are resource poor, and it adds up to the burden of the economy of these countries. Whereas stroke is slightly coming down in incidence in the developed countries because of the awareness and the treatment modalities that are frequently available, as compared to a slight increase in the stroke incidence in the underdeveloped countries. So in India, at least about 1.5 million people are affected, and this leaves a big gap in the life of a patient who is affected with a stroke. It not only affects the person with a stroke, it affects the whole family, whole society, and in turn the country in terms of economical burden. Now, we have a lot of developments in terms of stroke, in first identifying the stroke as well as the diagnosis and the treatment. Now, at this point of time, I would want to emphasize to the public that please try to memorize and identify the person who gets affected with the stroke by a simple thing called a FAST, F-A-S-T. FAST is, F is face. You observe anybody's face who is affected with the stroke. If you see that the facial symmetry is not maintained or sagging of the face to one side, he may have a stroke. Or second is A is arm drift. Then you ask the person to put both the arms straight. If one arm goes down, that may be another indication that the person may be suffering with a stroke. Third is, yes, when you find a person's speech is difficult or he is not able to get the words properly to speak, or he is slurring or dysarthric, that may be the third symptom of a stroke. So if you find out a person with any one of these three, you may be right to the extent of 80% that it may be a stroke. And T is immediately you have to transfer him to wherever there is a stroke treatment available, a reasonably good center. There are multiple risk factors for the stroke. The most common risk factor is the hypertension or high blood pressure. This amounts to about 70% of the etiology for the ischemic stroke and hemorrhagic stroke also. And also the next important risk factor is the diabetes uncontrolled especially, and high cholesterol level, obesity, and smoking and alcohol comes next. And in young people, the obesity and the sedentary type of lifestyle is the most important reason for young strokes. We see a lot of young strokes nowadays because of the change of lifestyle, no physical activity, and food habit difference compared to what it used to be in the past. So these are the risk factors which can be modified. I would like to emphasize that 80% of the strokes can be prevented by modifying these risk factors. So please remember, blood pressure, even if it is 2 millimeters high, can make a big difference in terms of stroke incidence. So managing these are very, very important. So we have diagnostic modalities in terms of development in MRI, CT, angio, perfusion studies, etc., which will identify the stroke at the earliest, where we can treat them earlier. One thing I would like to emphasize is that the earliest you get the patient to the hospital where it can be treated is the best chances for him to recover. We call this as a golden hour of brain stroke. That means after the first symptom, if he reaches the hospital within 3 to 3.5 hours, that is the best chances of improvement from the stroke without any disability. We have what is called a clot buster injection, which should be given within 3 to 4 hours after the onset of stroke. And sometimes if there is a major vessel blockage, we also have facilities to remove the clot and open up the channel which is blocked. So this should be utilized by majority of the patients who are affected with the stroke. And unfortunately, in India, in one of the recent studies which they have done, only 22% of the total population are aware of one symptom of stroke. So it is a ignorance of the public about the stroke and the identity of that. Still people think that if there is a stroke, he will not be benefited by any modern medications. They will take him to alternative medicine like massage or pigeon blood, etc., which will leave them disabled throughout their life. So it is important for the public to understand the earliest you bring to the facility where stroke can be treated is the best chances for the patient who is affected with a stroke to get better, and also indirectly it lessens the burden on the family and on the state, on the country as a whole. So my request for all of you, I would request on the Stroke Awareness Day on 29th of October, from that day onwards, please take a pledge that all of you become the messengers for spreading the awareness about the stroke by identifying simple slogan called FAST: face drooping and arm drifting. Third is speech difficulty, and if you find any one of these, rush them to a nearby well-equipped hospital to get them proper treatment, and that is how you help the society and help the family of the survivor. Thank you.